your brain is in Johnny's body, and we have to cut off your breasts and remove your uterus to construct a penis for you and make you to a girl. And to think that there are councils out there, as Mr. Winnie had mentioned, and some others had mentioned, that
Mr. Chairman, thank you. Let me get this right. There you go. My name is Andrew Rose. I'm a pediatrician at the Cheyenne Children's Clinic. I'm also representing the State Academy of Pediatrics today. I'm the current president of the Wyoming chapter. And I come in opposition to this bill for many reasons, but I just want to go through some notes I wrote. For 10 years, I've been here in Cheyenne helping families and kids, and at times I've had to be there when kids have felt boxed in by their gender that was assigned at birth. These kids and these families, as Dr. Prentice said earlier, they don't seek this out. They're not, you know, they don't want to find themselves in that situation, especially, why would they? Especially here in Wyoming. And no, these kids aren't just confused, they're not immature, they're not just in a state. Instead, they identify in a way that society tells them they shouldn't, and of course that creates dissonance. In respect to Senator Scott, who's never taken care of children, or probably really talked to teenagers that have been in the same situation, or the families going through this directly, no, this is not a simple problem. This is not just X's and Y's, and you're not looking, I mean, if you are looking for a cause, we're talking about differences in brain chemistry, not just a whim or an adolescent phase or fad, as was mentioned. The dissonance that I talk about, felt by these teenagers, is problematic. It leads to a whole host of issues, including depression, anxiety, homelessness, and suicide when that's allowed to continue. And it's been proven, and really makes sense, that if there's a society that refuses to affirm people where they're at, no matter what the issue is, those problems are going to get worse. And the alternative is true too, however. The sooner that we accept kids where they're at, the better those outcomes will be for them. So really, if we want to do something that actually is beneficial and protects children and teenagers, why doesn't Wyoming start by taking on the task of reducing suicide rate? Because right now, teenagers with gender dysphoria are arguably the most at-risk group of kids at that age for suicide. Let's actually provide acceptance and the gender-affirming care that they need, the care that's been proven to decrease risk of suicide, said over and over. And we won't accomplish this by sending messages to physicians and to parents that they will be locked up for doing the right thing for children. And regardless, here in Wyoming, we're not doing surgeries. There's no one doing the irreversible therapies on kids here in Wyoming. The hormone therapies that are spoken about, that could be given in our state, probably prescribed out of state, those hormone therapies are meant to delay puberty. And true, there are problems, like the research isn't complete in terms of effects on bone and long-term.
15 seconds.
The long-term effects. So but the things that are done currently would be reversible. Frankly, in good conscience, I just don't know how a group of supposed proponents of limited government and individual liberty who don't have expertise in the area want to take away parental rights and autonomy and make it a felony for physicians to practice here and to do the right thing for kids. And if that continues, I don't see myself and most of my colleagues wanting to practice in a state where that is true. Thank you.
Question, Senator Dockstader.
Thank you, Doctor. Thank you for coming. Similar question to our state psychologist. This is a unanimous vote in your association?
Go ahead, Doctor.
Sorry, my colleagues and I, we communicate primarily, because we're so spread out, via a kind of email and internet network. And so we haven't had like a formal vote, but at our last meeting, we had discussed gender affirming care at our society meeting in October, and that's where the sort of more or less consensus has come from.
Thank you, Doctor.
Further questions, Senator Bouchard.
Thank you, Mr. Chairman. Something that you said, Doctor, about being reversible. One of the questions that I'm asking is how do you reverse a removal of mammary glands to the point where they've scraped down, even taken away all the tissue that has the ducting. And the other thing is you mentioned something about depression and other mental illnesses. From the studies that I've seen, which includes up to 92%, they did not treat just those depression and other ailments and went right to what they said was a transgender problem. But yet in those same studies, if they just got them through the depression and the other ailments, they would get through life and actually even be comfortable in their bodies. Maybe some of them would have homosexual tendencies. It was a very small percentage. Isn't that doing no harm? I mean, when we start taking a scalpel out and start doing procedures, we're doing something totally different. I'm just not sure it's reversible. And I just want to add one more thing. I've done a deep dive into this, and I've seen some of the surgeries they're doing in some of these hospitals, in children's hospitals, mind you, although they haven't. Some of them aren't children yet because they're trying. It looks to me like they're trying to do it in people that are over 18 in children's hospitals as they move to make it acceptable. And they've done what they call, I mean, I don't know what the procedure is actually, what we would call it in the layman's terms, but they're adding what they call a penis that's no bigger than the tip of this pen. And I wonder what the ramifications are to somebody who they've convinced that that's okay when they get older and figure out that, wow, that doesn't look normal.
Doctor, go ahead and answer those questions.
Chairman, thank you. So to speak to the first point, when I mentioned reversible procedures, I'm discussing hormone therapy primarily that is based on blocking the progression of sexual maturation, so which is reversible. And what I had said is that no one here in the state of Wyoming is doing the types of procedures that you graphically explained for us all. And frankly, if those kind of things are being done, we as an Academy of Pediatrics would also oppose that. However, to blanket, restrict, and criminalize the processes that take a long time to work through. Yes, we're treating depression ahead of time, and yes, we're trying to deal with the anxieties and everything else that comes along with this very difficult and very complicated situation. As was mentioned by a speaker before me, this is not simple, and yes, we try whatever we can do in the least harmful and lasting way. So we are definitely going to be doing, we always abide by the rule of do no harm, but I don't think we can ignore the statistics that children with gender dysphoria have such a higher rate of all these things: depression, anxiety, homelessness, suicide, that it would be irresponsible to not fully be able to use our entire toolbox at the outset. And I'm not saying we need to do this in any kind of genital manipulation or mutilation, as was mentioned, but we don't need to criminalize and make it so that people like myself don't want to practice here.
Okay, thank you. Go ahead.
Sir, I had a
Go
question.
ahead, Senator Hutchins, quickly, please.
I'll try. Doctor, do you have statistics on those people that have been transitioned, their rate of suicide?
Go ahead, doctor.
I don't have those exact statistics, no.
Thank you. Quick follow-up, Mr. Chair.
Go ahead, ma'am.
Sir, you talked about reversal of the hormone therapy. What happens to the body? Let's just say you started the hormones therapy at 12. Now I'm 20. I don't want to go through the therapy anymore. You stop the therapy. What happens to the body?
Go ahead, doctor.
Mr. Chairman, thank you. So, it depends on what we're talking about. Hormone therapy is a pretty broad topic, but if you're talking about just puberty suppression, I don't think there's many that would continue puberty suppression for that long, just because of what we know about potentials with bone mineralization, et cetera. But some, and I will say that some types of hormone therapy, like if you're talking about estrogen therapy and testosterone therapy, those I wouldn't say those are completely reversible. When I mention what is happening in our state potentially at the current moment, we're talking about there are some hormones that are meant to stop the progression of puberty, and those are the ones that might be used just to allow these children and teenagers a little more time to go through social transition and to make sure that this is the right decision for them. It's not, we're not doing estrogen, testosterone therapies like that. So, and to answer your final question, if those hormones are given, there could be, there are some risks with those therapies too. But we have been using sex hormone or puberty suppression, I should say, those types of medicines for precocious puberty or early puberty for decades, and they work in younger children without long side effects. But I will say we haven't been using them probably for long enough to know any really long-term effects.
One super quick.
Let's move on and get the next testimony first, because we're running out
This
of
could be for
time.
both.
Well, let's get her testimony
Okay.
first, and then we'll decide. Go ahead.